Section 8 of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by Leanne Howlett. Anatomy of the Human Body, Part 3, by Henry Gray. Peculiarities in the vascular system in the fetus. The chief peculiarities of the fetal heart are the direct communication between the atria through the foramen oval and the large size of the valve of the inferior vena cava. Among other peculiarities the following may be noted. 1. In early fetal life the heart lies immediately below the mandibular arch and is relatively large in size. As development proceeds, it is gradually drawn within the thorax, but at first it lies in the middle line. Toward the end of pregnancy it gradually becomes oblique in direction. 2. For a time the atrial portion exceeds the ventricular in size, and the walls of the ventricles are of equal thickness. Toward the end of fetal life the ventricular portion becomes the larger, and the wall of the left ventricle exceeds that of the right in thickness. 3. Its size is large as compared with that of the rest of the body, the proportion at the second month being 1:50, and at birth 1:120, while in the adult the average is about 1:160. The foramen oval, situated at the lower part of the atrial septum, forms a free communication between the atria until the end of fetal life. A septum, septum secundum, grows down from the upper wall of the atrium to the right of the primary septum in which the foramen oval is situated. Shortly after birth it fuses with the primary septum and the foramen oval is obliterated. The valve of the inferior vena cava serves to direct the blood from that vessel through the foramen oval into the left atrium. The peculiarities in the arterial system of the fetus are the communication between the pulmonary artery and the aorta by means of the ductus arteriosus, and the continuation of the hypogastric arteries as the umbilical arteries to the placenta. The ductus arteriosus is a short tube, about 1.25 centimeters in length at birth, and of the diameter of a goose quill. In the early condition it forms the continuation of the pulmonary artery and opens into the aorta just beyond the origin of the left subclavian artery, and so conducts the greater amount of the blood from the right ventricle into the aorta. When the branches of the pulmonary artery have become larger relatively to the ductus arteriosus, the latter is chiefly connected to the left pulmonary artery. The hypogastric arteries run along the sides of the bladder and thence upward on the back of the anterior abdominal wall to the umbilicus. Here they pass out of the abdomen and are continued as the umbilical arteries in the umbilical cord to the placenta. They convey the fetal blood to the placenta. The peculiarities in the venous system of the fetus are the communications established between the placenta and the liver and portal vein through the umbilical vein, and between the umbilical vein and the inferior vena cava through the ductus venosus. Fetal circulation. The fetal blood is returned from the placenta to the fetus by the umbilical vein. This vein enters the abdomen at the umbilicus and passes upward along the free margin of the falciform ligament of the liver to the under surface of that organ, where it gives off 2 or 3 branches, one of large size to the left lobe, and others to the lobus quadratus and lobus caudatus. At the porta hepatis, transverse fissure of the liver, it divides into 2 branches. Of these the larger is joined by the portal vein and enters the right lobe. The smaller is continued upward under the name of the ductus venosus, and joins the inferior vena cava. The blood, therefore, which traverses the umbilical vein, passes to the inferior vena cava in 3 different ways. A considerable quantity circulates through the liver with the portal venous blood, before entering the inferior vena cava by the hepatic veins. Some enters the liver directly, and is carried to the inferior cava by the hepatic veins. The remainder passes directly into the inferior vena cava through the ductus venosus. In the inferior vena cava, the blood carried by the ductus venosus and hepatic veins become mixed with that returning from the lower extremities and abdominal wall. It enters the right atrium, and, guided by the valve of the inferior vena cava, passes through the foramen oval into the left atrium, where it mixes with a small quantity of blood returned from the lungs by the pulmonary veins. From the left atrium it passes into the left ventricle, and from the left ventricle into the aorta, by means of which it is distributed almost entirely to the head and upper extremities, a small quantity being probably carried into the descending aorta. From the head and upper extremities the blood is returned by the superior vena cava to the right atrium, where it mixes with a small portion of the blood from the inferior vena cava. From the right atrium it descends into the right ventricle, and thence passes into the pulmonary artery. The lungs of the fetus being inactive, only a small quantity of the blood of the pulmonary artery is distributed to them by the right and left pulmonary arteries, and returned by the pulmonary veins to the left atrium. The greater part passes through the ductus arteriosus into the aorta, where it mixes with a small quantity of the blood transmitted by the left ventricle into the aorta. Through this vessel it descends, and is in part distributed to the lower extremities and the viscera of the abdomen and pelvis, but the greater amount is conveyed by the umbilical arteries to the placenta. From the preceding account of the circulation of the blood in the fetus the following facts will be evident. 1. The placenta serves the purposes of nutrition and excretion, receiving the impure blood from the fetus, and returning it purified and charged with additional nutritive material. 2. Nearly the whole of the blood of the umbilical vein traverses the liver before entering the inferior vena cava. Hence the large size of the liver, especially at an early period of fetal life. 3. The right atrium is the point of meeting of a double current, the blood in the inferior vena cava being guided by the valve of this vessel into the left atrium, while that in the superior vena cava descends into the right ventricle. At an early period of fetal life it is highly probable that the two streams are quite distinct, for the inferior vena cava opens almost directly into the left atrium, and the valve of the inferior vena cava would exclude the current from the right ventricle. At a later period, as the separation between the two atria becomes more distinct, it seems probable that some mixture of the two streams must take place. 4. The pure blood carried from the placenta to the fetus by the umbilical vein, mixed with the blood from the portal vein and inferior vena cava, passes almost directly to the arch of the aorta, and is distributed by the branches of that vessel to the head and upper extremities. 5. The blood contained in the descending aorta, chiefly derived from that which is already circulated through the head and limbs, together with a small quantity from the left ventricle, is distributed to the abdomen and lower extremities. Changes in the vascular system at birth. At birth, when respiration is established, an increased amount of blood from the pulmonary artery passes through the lungs, and the placental circulation is cut off. The foramen oval is closed by about the 10th day after birth. The valvular fold above mentioned adheres to the margin of the foramen for the greater part of its circumference, but a slit-like opening is left between the two atria above, and this sometimes persists. The ductus arteriosus begins to contract immediately after respiration is established, and is completely closed from the 4th to the 10th day. It ultimately degenerates into an impervious cord, the ligamentum arteriosum, which connects the left pulmonary artery to the arch of the aorta. Of the hypogastric arteries, the parts extending from the sides of the bladder to the umbilicus become obliterated between the 2nd and 5th days after birth, and project as fibrous cords, the lateral umbilical ligaments toward the abdominal cavity carrying on them folds of peritoneum. The umbilical vein and ductus venosus are completely obliterated between the 2nd and 5th days after birth. The former becomes the ligamentum teres, the latter the ligamentum venosum of the liver. End of section 8. Recording by Leanne Howlett.
Section 9 of Gray's Anatomy Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 3, by Henry Gray. The Arteries, Introduction. The distribution of the systemic arteries is like a highly ramified tree, the common trunk of which, formed by the aorta, commences at the left ventricle, while the smallest ramifications extend to the peripheral parts of the body and the contained organs. Arteries are found in all parts of the body except in the hairs, nails, epidermis, cartilages, and cornea. The larger trunks usually occupy the most protected situations, running in the limbs along the flexor surface, where they are less exposed to injury. There is considerable variation in the mode of division of the arteries. Occasionally a short trunk subdivides into several branches at the same point, as may be observed in the celiac artery and the thyrocervical trunk. The vessel may give off several branches in succession and still continue as the main trunk, as is seen in the arteries of the limbs, or the division may be dichotomous, as for instance when the aorta divides into the two common iliacs. A branch of an artery is smaller than the trunk from which it arises, but if an artery divides into two branches, the combined sectional area of the two vessels is, in nearly every instance, somewhat greater than that of the trunk, and the combined sectional area of all the arterial branches greatly exceeds that of the aorta, so that the arteries collectively may be regarded as a cone, the apex of which corresponds to the aorta, and the base to the capillary system. The arteries, in their distribution, communicate with one another, forming what are called anastomoses, and these communications are very free between the large as well as between the smaller branches. The anastomosis between trunks of equal size is found where great activity of the circulation is requisite, as in the brain. Here the two vertebral arteries unite to form the basilar, and the two anterior cerebral arteries are connected by a short communicating trunk. It is also found in the abdomen, where the intestinal arteries have very ample anastomoses between their larger branches. In the limbs, the anastomoses are most numerous and of largest size around the joints, the branches of an artery above uniting with branches from the vessels below. These anastomoses are of considerable interest to the surgeon, as it is by their enlargement that a collateral circulation is established after the application of a ligature to an artery. The smaller branches of arteries anastomose more frequently than the larger, and between the smallest twigs these anastomoses become so numerous as to constitute a close network that pervades nearly every tissue of the body. Throughout the body, generally, the larger arterial branches pursue a fairly straight course, but in certain situations they are tortuous. Thus the external maxillary artery in its course over the face and the arteries of the lips are extremely tortuous to accommodate themselves to the movements of the parts. The uterine arteries are also tortuous to accommodate themselves to the increase in size which the uterus undergoes during pregnancy. The pulmonary artery conveys the venous blood from the right ventricle of the heart to the lungs. It is a short, wide vessel, about 5 centimeters in length and 3 centimeters in diameter, arising from the conus arteriosus of the right ventricle. It extends obliquely upward and backward, passing at first in front and then to the left of the ascending aorta, as far as the under surface of the aortic arch, where it divides, about the level of the fibrocartilage between the 5th and 6th thoracic vertebrae, into right and left branches of nearly equal size. Relations. The whole of this vessel is contained within the pericardium. It is enclosed with the ascending aorta in a single tube of the visceral layer of the serous pericardium, which is continued upward upon them from the base of the heart. The fibrous layer of the pericardium is gradually lost upon the external coats of the two branches of the artery. In front, the pulmonary artery is separated from the anterior end of the second left intercostal space by the pleura and the left lung, in addition to the pericardium. It rests at first upon the ascending aorta, and higher up lies in front of the left atrium on a plane posterior to the ascending aorta. On either side of its origin is the auricula of the corresponding atrium and a coronary artery, the left coronary artery passing, in the first part of its course, behind the vessel. The superficial part of the cardiac plexus lies above its bifurcation, between it and the arch of the aorta. The right branch of the pulmonary artery, ramus dexter A pulmonalis, longer and larger than the left, runs horizontally to the right, behind the ascending aorta and superior vena cava, and in front of the right bronchus, to the root of the right lung, where it divides into two branches. The lower and larger of these goes to the middle and lower lobes of the lung. The upper and smaller is distributed to the upper lobe. The left branch of the pulmonary artery, ramus sinister A pulmonalis, shorter and somewhat smaller than the right, passes horizontally in front of the descending aorta and left bronchus to the root of the left lung, where it divides into two branches, one for each lobe of the lung. Above, it is connected to the concavity of the aortic arch by the ligamentum arteriosum, on the left of which is the left recurrent nerve, and on the right the superficial part of the cardiac plexus. Below, it is joined to the upper left pulmonary vein by the ligament of the left vena cava. The terminal branches of the pulmonary arteries will be described with the anatomy of the lungs. End of section 9.
End of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Suzanne Olson. Anatomy of the Human Body, Part 3, by Henry Gray, The Aorta. The aorta is the main trunk of a series of vessels which convey the oxygenated blood to the tissues of the body for their nutrition. It commences at the upper part of the left ventricle, where it is about 3 centimeters in diameter, and after ascending for a short distance, arches backward and to the left side over the root of the left lung. It then descends within the thorax on the left side of the vertebral column, passes into the abdominal cavity through the aortic hiatus in the diaphragm, and ends considerably diminished in size, about 1.75 centimeters in diameter, opposite the lower border of the fourth lumbar vertebra, by dividing into the right and left common iliac arteries. Hence it is described in several portions, viz. the ascending aorta, the arch of the aorta, and the descending aorta, which last is again divided into the thoracic and abdominal aortae. The ascending aorta, aorta ascendens. The ascending aorta is about 5 centimeters in length. It commences at the upper part of the base of the left ventricle on a level with the lower border of the third costal cartilage behind the left half of the sternum. It passes obliquely upward, forward, and to the right in the direction of the heart's axis, as high as the upper border of the second right costal cartilage, describing a slight curve in its course, and being situated about 6 centimeters behind the posterior surface of the sternum. At its origin it presents, opposite the segments of the aortic valve, 3 small dilatations called the aortic sinuses. At the union of the ascending aorta with the aortic arch, the caliber of the vessel is increased, owing to a bulging of its right wall. This dilatation is termed the bulb of the aorta, and on transverse section presents a somewhat oval figure. The ascending aorta is contained within the pericardium and is enclosed in a tube of the serous pericardium, common to it and the pulmonary artery. Relations. The ascending aorta is covered at its commencement by the trunk of the pulmonary artery in the right auricula, and higher up is separated from the sternum by the pericardium, the right pleura, the anterior margin of the right lung, and some loose areolar tissue, and the remains of the thymus. Posteriorly, it rests upon the left atrium and right pulmonary artery. On the right side, it is in relation with the superior vena cava and right atrium, the former lying partly behind it on the left side with the pulmonary artery. Branches. The only branches of the ascending aorta are the 2 coronary arteries which supply the heart. They arise near the commencement of the aorta, immediately above the attached margins of the semilunar valves. The coronary arteries. The right coronary artery, A coronaria cordis dextra, arises from the right anterior aortic sinus. It passes at first between the conus arteriosus and the right auricula, and then runs in the right portion of the coronary sulcus, coursing at first from left to right, and then on the diaphragmatic surface of the heart, from right to left, as far as the posterior longitudinal sulcus, down which it continued to the apex of the heart as a posterior descending branch. It gives off a large marginal branch which follows the acute margin of the heart and supplies branches to both surfaces of the right ventricle. It also gives twigs to the right atrium and to the part of the left ventricle which adjoins the posterior longitudinal sulcus. The left coronary artery, A coronaria cordis sinistra, larger than the right, arises from the left anterior aortic sinus and divides into an anterior descending and a circumflex branch. The anterior descending branch passes at first behind the pulmonary artery and then comes forward between that vessel and the left auricula to reach the anterior longitudinal sulcus, along which it descends to the incisura apicus cordis. It gives branches to both ventricles. The circumflex branch follows the left part of the coronary sulcus, running first to the left and then to the right, reaching nearly as far as the posterior longitudinal sulcus. It gives branches to the left atrium and ventricle. There is a free anastomosis between the minute branches of the two coronary arteries in the substance of the heart. Peculiarities. These vessels occasionally arise by a common trunk, or their number may be increased to 3, the additional branch being of small size. More rarely, there are 2 additional branches. The arch of the aorta. Arcus aortae transverse aorta. The arch of the aorta begins at the level of the upper border of the second sternocostal articulation of the right side and runs at first upward, backward, and to the left in front of the trachea. It is then directed backward on the left side of the trachea and finally passes downward on the left side of the body of the fourth thoracic vertebra, at the lower border of which it becomes continuous with the descending aorta. It thus forms 2 curvatures, one with its convexity upward, the other with its convexity forward and to the left. Its upper border is usually about 2.5 centimeters below the superior border to the manubrium sterni. Relations. The arch of the aorta is covered anteriorly by the pleurae and anterior margins of the lungs and by the remains of the thymus. As the vessel runs backward, its left side is in contact with the left lung and pleura. Passing downward on the left side of this part of the arch are 4 nerves. In order from backwards, these are the left phrenic, the lower of the superior cardiac branches of the left vagus, the superior cardiac branch of the left sympathetic, and the trunk of the left vagus. As the last nerve crosses the arch, it gives off its recurrent branch, which hooks around below the vessel and then passes upward on its right side. The highest left intercostal vein runs obliquely upward and forward on the left side of the arch between the phrenic and vagus nerves. On the right are the deep part of the cardiac plexus, the left recurrent nerve, the esophagus, and the thoracic duct. The trachea lies behind and to the right of the vessel. Above are the innominate, left common carotid, and left subclavian arteries, which arise from the convexity of the arch and are crossed close to their origins by the left innominate vein. Below are the bifurcation of the pulmonary artery, the left bronchus, the ligamentum anteriosum, the superficial part of the cardiac plexus, and the left recurrent nerve. As already stated, the ligamentum arteriosum connects the commencement of the left pulmonary artery to the aortic arch. Between the origin of the left subclavian artery and the attachment of the ductus arteriosus, the lumen of the fetal aorta is considerably narrowed, forming what is termed the aortic isthmus. While immediately beyond the ductus arteriosus, the vessel presents a fusiform dilation which His has named the aortic spindle, the point of junction of the two parts being marked in the concavity of the arch by an indentation or angle. These conditions persist to some extent in the adult, where His found that the average diameter of the spindle exceeded that of the isthmus by 3 millimeters. Distinct from this diffuse and moderate stenosis at the isthmus is the condition known as coarctation of the aorta, or marked stenosis, often amounting to complete obliteration of its lumen, seen in adults and occurring at or near, oftenest a little below, the insertion of the ligamentum arteriosum into the aorta. According to Bonnet, this coarctation is never found in the fetus or at birth, and is due to an abnormal extension of the peculiar tissue of the ductus into the aortic wall, which gives rise to a simultaneous stenosis of both vessels as it contracts after birth. The ductus is usually obliterated in these cases. An extensive collateral circulation is set up by the costocervicals, internal mammaries, and the descending branches of the transverse cervical above the stenosis, and below it by the first 4 aortic intercostals, the pericardiacophrenics, and the superior and inferior epigastrics. Peculiarities. The height to which the aorta rises in the thorax is usually about 2.5 centimeters below the upper border of the sternum, but it may ascend nearly to the top of the bone. Occasionally it's found 4 centimeters, more rarely from 5 to 8 centimeters below this point. Occasionally it is found 4 centimeters, more rarely from 5 to 8 centimeters below this point. Sometimes the aorta arches over the root of the right lung, right aortic arch, instead of over that of the left, and passes down on the right side of the vertebral column, a condition which is found in birds. In such cases, all the thoracic and abdominal viscera are transposed. Less frequently the aorta, after arching over the root of the right lung, is directed to its usual position on the left side of the vertebral column. This peculiarity is not accompanied by transposition of the viscera. The aorta occasionally divides, as in some quadrupeds, into an ascending and a descending trunk, the former of which is directed vertically upward and subdivides into 3 branches to supply the head and upper extremities. Sometimes the aorta subdivides near its origin into 2 branches which soon reunite. In one of these cases, the esophagus and trachea were found to pass through the interval between the 2 branches. This is the normal condition of the vessel in the reptilia. Branches. The branches given off from the arch of the aorta are 3 in number: the innominate, the left common carotid, and the left subclavian. Peculiarities. Position of the branches. The branches, instead of arising from the highest part of the arch, may spring from the commencement of the arch or upper part of the ascending aorta, or the distance between them at their origins may be increased or diminished, the most frequent change in this respect being the approximation of the left carotid toward the innominate artery. The number of the primary branches may be reduced to 1, or more commonly 2, the left carotid arising from the innominate artery, or, more rarely, the carotid and subclavian arteries of the left side arising from a left innominate artery. But the number may be increased to 4 from the right carotid and subclavian arteries arising directly from the aorta, the innominate being absent. In most of these latter cases, the right subclavian has been found to arise from the left end of the arch. In other cases, it is the second or third branch given off instead of the first. Another common form in which there are 4 primary branches is that in which the left vertebral artery arises from the arch of the aorta between the left carotid and subclavian arteries. Lastly, the number of trunks from the arch may be increased to 5 or 6. In these instances, the external and internal carotids arise separately from the arch. the common carotid being absent on one or both sides. In some cases, 6 branches have been found, and this condition is associated with the origin of both vertebral arteries from the arch. Number usual, arrangement different. When the aorta arches over to the right side, the 3 branches have an arrangement the reverse of what is usual. The innominate artery is the left one, and the right carotid and subclavian arise separately. In other cases, where the aorta takes its usual course, the 2 carotids may be joined in a common trunk, and the subclavians arise separately from the arch, the right subclavian generally arising from the left end of the arch. In some instances, other arteries spring from the arch of the aorta. Of these, the most common are the bronchial, one or both, and the thyroidea ema, but the internal mammary and the inferior thyroid have been seen to arise from this vessel. The innominate artery, A. Anonyma brachiocephalic artery. The innominate artery is the largest branch of the arch of the aorta and is from 4 to 5 centimeters in length. It arises on a level with the upper border of the second right costal cartilage from the commencement of the arch of the aorta on a plane anterior to the origin of the left carotid. It ascends obliquely upward, backward, and to the right to the level of the upper border of the right sternoclavicular articulation, where it divides into the right common carotid and right subclavian arteries. Relations. Anteriorly, it is separated from the manubrium sterni by the sternohyoides and sternothyroideus, the remains of the thymus, the left innominate and right inferior thyroid veins which cross its root, and sometimes the superior cardiac branches of the right vagus. Posterior to it is the trachea, which it crosses obliquely. On the right side are the right innominate vein, the superior vena cava, the right phrenic nerve, and the pleura, and on the left side the remains of the thymus, the origin of the left common carotid artery, the inferior thyroid veins, and the trachea. Branches. The innominate artery usually gives off no branches, but occasionally a small branch, the thyroidea ema, arises from it. Sometimes it gives off a thymic or bronchial branch. The thyroidea ema, A. thyroidea ema, ascends in front of the trachea to the lower part of the thyroid gland which it supplies. It varies greatly in size and appears to compensate for deficiency or absence of one of the other thyroid vessels. It occasionally arises from the aorta, the right common carotid, the subclavian, or the internal mammary. Point of division. The innominate artery sometimes divides the level of the sternoclavicular joint, less frequently below it. Position. When the aortic arch is on the right side, the innominate is directed to the left side of the neck. Collateral circulation. Alan Burns demonstrated on the dead subject the possibility of the establishment of the collateral circulation after ligature of the innominate artery by tying and dividing that artery. He then found that even course injection impelled into the aorta passed freely by the anastomosing branches into the arteries of the right arm, filling them and all the vessels of the head completely. The branches by which this circulation would be carried on are very numerous. Thus, all the communications across the middle line between the branches of the carotid arteries of the opposite sides would be available for the supply of blood to the right side of the head and neck, while the anastomosis between the costo-cervical of the subclavian and the first aortic intercostal, see infra on the collateral circulation after obliteration of the thoracic aorta, would bring the blood by a free and direct course into the right subclavian. The numerous connections also between the intercostal arteries and the branches of the axillary and internal mammary arteries would doubtless assist in the supply of blood to the right arm, while the inferior epigastric from the external iliac would, by means of its anastomosis with the internal mammary, compensate for any deficiency in the vascularity of the wall of the chest. End of Section 10, Part 3, recorded by Suzanne Olson.
Of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Anatomy of the Human Body, Part 3, by Henry Gray. The common carotid artery. The principal arteries of supply to the head and neck are the two common carotids. They ascend in the neck, and each divides into two branches, viz. 1. The external carotid, supplying the exterior of the head, the face, and the greater part of the neck. 2. The internal carotid, supplying to a great extent the parts within the cranial and orbital cavities. The common carotid artery. A. Carotis communis. The common carotid arteries differ in length and in their mode of origin. The right begins at the bifurcation of the innominate artery behind the sternoclavicular joint and is confined to the neck. The left springs from the highest part of the arch of the aorta to the left of and on a plane posterior to the innominate artery, and therefore consists of a thoracic and a cervical portion. The thoracic portion of the left common carotid artery ascends from the arch of the aorta through the superior mediastinum to the level of the left sternoclavicular joint, where it is continuous with the cervical portion. Relations. In front, it is separated from the manubrium sterni by the sternohyoideus and sternothyroideus, the anterior portions of the left pleura and lung, the left innominate vein, and the remains of the thymus. Behind, it lies on the trachea, esophagus, left recurrent nerve, and thoracic duct. To its right side, below is the innominate artery, and above, the trachea, the inferior thyroid veins, and the remains of the thymus. To its left side are the left vagus and phrenic nerves, left pleura, and lung. The left subclavian artery is posterior and slightly lateral to it. The cervical portions of the common carotids resemble each other so closely that one description will apply to both. Each vessel passes obliquely upward from behind the sternoclavicular articulation to the level of the upper border of the thyroid cartilage, where it divides into the external and internal carotid arteries. At the lower part of the neck, the two common carotid arteries are separated from each other by a very narrow interval which contains the trachea, but at the upper part, the thyroid gland, the larynx, and pharynx project forward between the two vessels. The common carotid artery is contained in a sheath, which is derived from the deep cervical fascia and encloses also the internal jugular vein and vagus nerve, the vein lying lateral to the artery, and the nerve between the artery and vein, on a plane posterior to both. On opening the sheath, each of these three structures is seen to have a separate fibrous investment. Relations. At the lower part of the neck, the common carotid artery is very deeply seated, being covered by the integument, superficial fascia, platysma, and deep cervical fascia, the sternocleidomastoideus, sternohyoideus, sternothyroideus, and amohyoideus. In the upper part of its course it is more superficial, being covered merely by the integument, the superficial fascia, platysma, deep cervical fascia, and medial margin of the sternocleidomastoideus. When the latter muscle is drawn backward, the artery is seen to be contained in a triangular space, the carotid triangle, bounded behind by the sternocleidomastoideus, above by the stylohyoideus and posterior belly of the digastricus, and below by the superior belly of the amohyoideus. This part of the artery is crossed obliquely from its medial to its lateral side by the sternocleidomastoid branch of the superior thyroid artery, It is also crossed by the superior and middle thyroid veins, which end in the internal jugular. Descending in front of its sheath is the descending branch of the hypoglossal nerve, this filament being joined by one or two branches from the cervical nerves, which cross the vessel obliquely. Sometimes the descending branch of the hypoglossal nerve is contained within the sheath. The superior thyroid vein crosses the artery near its termination, and the middle thyroid vein a little below the level of the cricoid cartilage. The anterior jugular vein crosses the artery just above the clavicle, but is separated from it by the sternohyoideus and sternothyroideus. Behind, the artery is separated from the transverse processes of the cervical vertebrae by the longus colli and longus capitis, the sympathetic trunk being interposed between it and the muscles. The inferior thyroid artery crosses behind the lower part of the vessel. Medially, it is in relation with the esophagus, trachea, and thyroid gland, which overlaps it, the inferior thyroid artery and recurrent nerve being interposed, higher up, with the larynx and pharynx. Lateral to the artery are the internal jugular vein and vagus nerve. At the lower part of the neck, the right recurrent nerve crosses obliquely behind the artery. The right internal jugular vein diverges from the artery, but the left approaches and often overlaps the lower part of the artery. Behind the angle of bifurcation of the common carotid artery is a reddish-brown oval body, known as the glomus caroticum, carotid body. It is similar in structure to the glomus coccygum, coccygeal body, which is situated on the middle sacral artery. Peculiarities as to origin. The right common carotid may arise above the level of the upper border of the sternoclavicular articulation. This variation occurs in about 12% of cases. In other cases, the artery may arise as a separate branch from the arch of the aorta or in conjunction with the left carotid. The left common carotid varies in its origin more than the right. In the majority of abnormal cases, it arises with the innominate artery. If that artery is absent, the two carotids arise usually by a single trunk. It is rarely joined with the left subclavian, except in cases of transposition of the aortic arch. Peculiarities as to point of division. In the majority of abnormal cases, this occurs higher than usual. The artery dividing opposite or even above the hyoid bone. More rarely it occurs below, opposite the middle of the larynx or the lower border of the cricoid cartilage. One case is related by Morgagni, where the artery was only 4 centimeters in length and divided at the root of the neck. Very rarely the common carotid ascends in the neck without any subdivision, either the external or the internal carotid being wanting, and in a few cases the common carotid has been found to be absent, the external and internal carotids arising directly from the arch of the aorta. This peculiarity existed on both sides in some instances, on one side in others. Occasional branches. The common carotid usually gives off no branch previous to its bifurcation, but it occasionally gives origin to the superior thyroid or its laryngeal branch, the ascending pharyngeal, the inferior thyroid, or, more rarely, the vertebral artery. Collateral circulation. After ligature of the common carotid, the collateral circulation can be perfectly established by the free communication which exists between the carotid arteries of opposite sides, both without and within the cranium, and by enlargement of the branches of the subclavian artery on the side corresponding to that on which the vessel has been tied. The chief communications outside the skull take place between the superior and inferior thyroid arteries and the profunda cervicis and ramus descendens of the occipital. The vertebral takes the place of the internal carotid within the cranium. End of section 11. Recording by Selena Arter. Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Anatomy of the Human Body, Part 3, by Henry Gray. Section 12, Part 1. The external carotid artery. A. Carotis externa. The external carotid artery begins opposite the upper border of the thyroid cartilage, and, taking a slightly curved course, passes upward and forward, and then inclines backward to the space behind the neck of the mandible, where it divides into the superficial temporal and internal maxillary arteries. It rapidly diminishes in size in its course up the neck, owing to the number and large size of the branches given off from it. In the child, it is somewhat smaller than the internal carotid, but in the adult the two vessels are of nearly equal size. At its origin, this artery is more superficial, and placed nearer the middle line than the internal carotid, and is contained within the carotid triangle. Relations. The external carotid artery is covered by the skin, superficial fascia, platysma, deep fascia, and anterior margin of the sternocleidomastoideus. It is crossed by the hypoglossal nerve, by the lingual, rhinine, common facial, and superior thyroid veins, and by the digastricus and stylohyoideus. Higher up it passes deeply into the substance of the parotid gland, where it lies deep to the facial nerve and the junction of the temporal and internal maxillary veins. Medial to it are the hyoid bone, the wall of the pharynx, the superior laryngeal nerve, and a portion of the parotid gland. Lateral to it, in the lower part of its course, is the internal carotid artery. Posterior to it, near its origin, is the superior laryngeal nerve, and higher up it is separated from the internal carotid by the styloglossus and stylopharyngeus, the glossopharyngeal nerve, the pharyngeal branch of the vagus, and part of the parotid gland. Branches. The branches of the external carotid artery may be divided into 4 sets. 1. Anterior. Superior thyroid, lingual, external maxillary. 2. Posterior. Occipital, posterior auricular. 3. Ascending. Ascending pharyngeal. 4. Terminal. Superficial temporal, internal maxillary. 1. The superior thyroid artery, A. thyroidea superior, arises from the external carotid artery just below the level of the greater cornu of the hyoid bone, and ends in the thyroid gland. Relations. From its origin under the anterior border of the sternocleidomastoideus, it runs upward and forward for a short distance in the carotid triangle, where it is covered by the skin, platysma, and fascia. It then arches downward beneath the omohyoideus, sternohyoideus, and sternothyroideus. To its medial side are the constrictor pharyngeus inferior and the external branch of the superior laryngeal nerve. Branches. It distributes twigs to the adjacent muscles and numerous branches to the thyroid gland, anastomosing with its fellow of the opposite side, and with the inferior thyroid arteries. The branches to the gland are generally 2 in number. 1, the larger, supplies principally the anterior surface on the isthmus of the gland. It anastomoses with the corresponding artery of the opposite side. A second branch descends on the posterior surface of the gland and anastomoses with the inferior thyroid artery. Besides the arteries distributed to the muscles and to the thyroid gland, the branches of the superior thyroid are hyoid, sternocleidomastoid, superior laryngeal, cricothyroid. The hyoid branch, ramus hyoideus infrahyoid branch, is small and runs along the lower border of the hyoid bone, beneath the thyrohyoideus, and anastomoses with the vessel of the opposite side. The sternocleidomastoid branch, ramus sternocleidomastoideus sternomastoid branch, runs downward and lateralward across the sheath of the common carotid artery. and supplies the sternocleidomastoideus and neighboring muscles and integument. It frequently arises as a separate branch from the external carotid. The superior laryngeal artery, A. laryngeus superior, larger than either of the preceding, accompanies the internal laryngeal branch of the superior laryngeal nerve beneath the thyrohyoideus. It pierces the hyothyroid membrane and supplies the muscles, mucous membrane, and glands of the larynx, anastomosing with the branch from the opposite side. The cricothyroid branch, ramus cricothyroideus, is small and runs transversely across the cricothyroid membrane, communicating with the artery of the opposite side. 2. The lingual artery, A. lingualis, arises from the external carotid between the superior thyroid and external maxillary. It first runs obliquely upward and medialward to the greater cornu of the hyoid bone. It then curves downward and forward, forming a loop which is crossed by the hypoglossal nerve, and passing beneath the digastricus and the stylohyoideus, it runs horizontally forward, beneath the hyoglossus, and finally, ascending almost perpendicularly to the tongue, turns forward on its lower surface as far as the tip, under the name of the profunda linguae. Relations. Its first or oblique portion is superficial and is contained within the carotid triangle. It rests upon the constrictor pharyngeus medius and is covered by the platysma and the fascia of the neck. Its second or curved portion also lies upon the constrictor pharyngeus medius, being covered at first by the tendon of the digastricus and by the stylohyoideus, and afterward by the hyoglossus. Its third or horizontal portion lies between the hyoglossus and genioglossus. The fourth or terminal part, under the name of the profunda linguae, rhenine artery, runs along the under surface of the tongue to its tip. Here it is superficial, being covered only by the mucous membrane. Above it is the longitudinalis inferior, and on the medial side the genioglossus. The hypoglossal nerve crosses the first part of the lingual artery, but is separated from the second part by the hyoglossus. Branches. The branches of the lingual artery are hyoid, dorsalis linguae, sublingual, profunda linguae. The hyoid branch, ramus hyoideus, suprahyoid branch, runs along the upper border of the hyoid bone, supplying the muscles attached to it and anastomosing with its fellow of the opposite side. The arteriae dorsalis linguae, rami dorsalis linguae, consist usually of 2 or 3 small branches which arise beneath the hyoglossus. They ascend to the back of the dorsum of the tongue, and supply the mucous membrane in this situation, the glossopalatine arch, the tonsil, soft palate, and epiglottis, anastomosing with the vessels of the opposite side. The sublingual artery, A. sublingualis, arises at the anterior margin of the hyoglossus, and runs forward between the genioglossus and mylohyoideus to the sublingual gland. It supplies the gland and gives branches to the mylohyoideus and neighboring muscles, and to the mucous membrane of the mouth and gums. One branch runs behind the alveolar process of the mandible in the substance of the gum to anastomose with a similar artery from the other side. Another pierces the mylohyoideus and anastomoses with the submental branch of the external maxillary artery. The arteria profunda linguae, rhenine artery, deep lingual artery, is the terminal portion of the lingual artery. It pursues a tortuous course and runs along the under surface of the tongue, below the longitudinalis inferior, and above the mucous membrane. It lies on the lateral side of the genioglossus, accompanied by the lingual nerve. At the tip of the tongue, it is said to anastomose with the artery of the opposite side, but this is denied by Hyrtl. In the mouth, these vessels are placed one on either side of the frenulum linguae. 3. The external maxillary artery, A. maxillaris externa, facial artery, arises in the carotid triangle a little above the lingual artery and, sheltered by the ramus of the mandible, passes obliquely up beneath the digastricus and stylohyoideus, over which it arches to enter a groove on the posterior surface of the submaxillary gland. It then curves upward over the body of the mandible at the antero-inferior angle of the masseter, passes forward and upward across the cheek to the angle of the mouth, then ascends along the side of the nose, and ends at the medial commissure of the eye, under the name of the angular artery. This vessel, both in the neck and on the face, is remarkably tortuous, in the former situation, to accommodate itself to the movements of the pharynx in deglutition, and in the latter, to the movements of the mandible, lips, and cheeks. Relations. In the neck, its origin is superficial, being covered by the integument, platysma, and fascia. It then passes beneath the digastricus and stylohyoideus muscles and part of the submaxillary gland, and frequently beneath the hypoglossal nerve. It lies upon the constrictores pharyngeus medius and superior, the latter of which separates it, at the summit of its arch, from the lower and back part of the tonsil. On the face, where it passes over the body of the mandible, it is comparatively superficial, lying immediately beneath the platysma. In its course over the face, it is covered by the integument, the fat of the cheek, and, near the angle of the mouth, by the platysma, rhizorius, and zygomaticus. It rests on the buccinator and caninus, and passes either over or under the infraorbital head of the quadratus labii superioris. The anterior facial vein lies lateral to the artery, and takes a more direct course across the face, where it is separated from the artery by a considerable interval. In the neck it lies superficial to the artery. The branches of the facial nerve cross the artery from behind forward. Branches. The branches of the artery may be divided into two sets, those given off in the neck, cervical, and those on the face, facial. Cervical branches. Ascending palatine, tonsillar, glandular, submental, muscular. Facial branches. Inferior labial, superior labial, lateral nasal, angular, muscular. The ascending palatine artery, A palatina ascendens, arises close to the origin of the external maxillary artery, and passes up between the styloglossus and stylopharyngeus to the side of the pharynx, along which it is continued between the constrictor pharyngeus superior and the pterogordius internus to near the base of the skull. It divides near the levator villi palatini into two branches. One follows the course of this muscle, and, winding over the upper border of the constrictor pharyngeus superior, supplies the soft palate and the palatine glands, anastomosing with its fellow of the opposite side and with the descending palatine branch of the internal maxillary artery. The other pierces the constrictor pharyngeus superior and supplies the palatine tonsil and auditory tube, anastomosing with the tonsillar and ascending pharyngeal arteries. The tonsillar branch, ramus tonsillaris, ascends between the pterogordius internus and styloglossus, and then along the side of the pharynx, perforating the constrictor pharyngeus superior to ramify in the substance of the palatine tonsil and root of the tongue. The glandular branches, rami glandulari submaxillary branches, consist of 3 or 4 large vessels, which supply the submaxillary gland, some being prolonged to the neighboring muscles, lymph glands, and integument. The submental artery, A submentalis, the largest of the cervical branches, is given off from the facial artery just as that vessel quits the submaxillary gland. It runs forward upon the mylohyoideus, just below the body of the mandible, and beneath the digastricus. It supplies the surrounding muscles, and anastomoses with the sublingual artery and with the mylohyoid branch of the inferior alveolar. At the symphysis menti it turns upward over the border of the mandible and divides into a superficial and a deep branch. The superficial branch passes between the integument and quadratus labii inferioris, and anastomoses with the inferior labial artery. The deep branch runs between the muscle and the bone, supplies the lip, and anastomoses with the inferior labial and mental arteries. The inferior labial artery, A labialis inferior, inferior coronary artery, arises near the angle of the mouth. It passes upward and forward beneath the triangularis and, penetrating the orbicularis oris, runs in a tortuous course along the edge of the lower lip between this muscle and the mucous membrane. It supplies the labial glands, the mucous membrane, and the muscles of the lower lip, and anastomoses with the artery of the opposite side, and with the mental branch of the inferior alveolar artery. The superior labial artery, A labialis superior, superior coronary artery, is larger and more tortuous than the inferior. It follows a similar course along the edge of the upper lip, lying between the mucous membrane and the orbicularis oris, and anastomoses with the artery of the opposite side. It supplies the upper lip and gives off in its course 2 or 3 vessels which ascend to the nose. A septal branch ramifies on the nasal septum as far as the point of the nose, and an alar branch supplies the ala of the nose. The lateral nasal branch is derived from the external maxillary, as that vessel ascends along the side of the nose. It supplies the ala and dorsum of the nose, anastomosing with its fellow, with the septal and alar branches, with the dorsal nasal branch of the ophthalmic, and with the infraorbital branch of the internal maxillary. The angular artery, A angularis, is the terminal part of the external maxillary. It ascends to the medial angle of the orbit, embedded in the fibers of the angular head of the quadratus labii superioris, and accompanied by the angular vein. On the cheek it distributes branches which anastomose with the infraorbital, after supplying the lacrimal sac and orbicularis oculi. It ends by anastomosing with the dorsal nasal branch of the ophthalmic artery. The muscular branches in the neck are distributed to the pterogordius internus and stylohyoideus, and on the face to the masseter and buccinator. The anastomoses of the external maxillary artery are very numerous, not only with the vessel of the opposite side, but, in the neck, with the sublingual branch of the lingual, with the ascending pharyngeal, and by its ascending palatine and tonsillar branches with the palatine branch of the internal maxillary. On the face, with the mental branch of the inferior alveolar as it emerges from the mental foramen, with the transverse facial branch of the superficial temporal, with the infraorbital branch of the internal maxillary, and with the dorsal nasal branch of the ophthalmic. Peculiarities. The external maxillary artery not infrequently arises in common with the lingual. It varies in its size and in the extent to which it supplies the face. It occasionally ends at the submental, and not infrequently extends only as high as the angle of the mouth or nose. The deficiency is then compensated for by enlargement of one of the neighboring arteries. 4. The occipital artery, A occipitalis, arises from the posterior part of the external carotid, opposite the external maxillary, near the lower margin of the posterior belly of the digastricus, and ends in the posterior part of the scalp. Course and relations. At its origin, it is covered by the posterior belly of the digastricus and the stylohyoideus, and the hypoglossal nerve winds around it from behind forward. Higher up, it crosses the internal carotid artery, the internal jugular vein, and the vagus and accessory nerves. It next ascends to the interval between the transverse process of the atlas and the mastoid process of the temporal bone, and passes horizontally backward, grooving the surface of the latter bone, being covered by the sternocleidomastoideus, splenius capitis, longissimus capitis, and digastricus, and resting upon the rectus capitis lateralis, the obliquus superior, and semi-spinalis capitis. It then changes its course and runs vertically upward, pierces the fascia connecting the cranial attachment of the trapezius with the sternocleidomastoideus, and ascends in a tortuous course in the superficial fascia of the scalp, where it divides into numerous branches, which reach as high as the vertex of the skull, and anastomose with the posterior auricular and superficial temporal arteries. Its terminal portion is accompanied by the greater occipital nerve. Branches. The branches of the occipital artery are muscular, sternocleidomastoid, auricular, meningeal, descending. The muscular branches, rami muscularis, supply the digastricus, stylohyoideus, splenius, and longissimus capitis. The sternocleidomastoid artery, A. sternocleidomastoidea, sternomastoid artery, generally arises from the occipital close to its commencement, but sometimes springs directly from the external carotid. It passes downward and backward over the hypoglossal nerve and enters the substance of the muscle, in company with the accessory nerve. The auricular branch, ramus auricularis, supplies the back of the concha and frequently gives off a branch, which enters the skull through the mastoid foramen and supplies the dura mater, the diploe, and the mastoid cells. This latter branch sometimes arises from the occipital artery, and is then known as the mastoid branch. The meningeal branch, ramus meningeus dural branch, ascends from the internal jugular vein and enters the skull through the jugular foramen and condyloid canal to supply the dura mater in the posterior fossa. The descending branch, ramus descendens, arteria princeps cervicis. The largest branch of the occipital descends on the back of the neck and divides into a superficial and deep portion. The superficial portion runs beneath the splenius, giving off branches which pierce that muscle to supply the trapezius, and anastomose with the ascending branch of the transverse cervical. The deep portion runs down between the semispinalis capitis and coli, and anastomoses with the vertebral and with the a profunda cervicalis, a branch of the costocervical trunk. The anastomosis between these vessels assists in establishing the collateral circulation after ligature of the common carotid or subclavian artery. The terminal branches of the occipital artery are distributed to the back of the head. They are very tortuous, and lie between the integument and the occipitalis, anastomosing with the artery of the opposite side and with the posterior auricular and temporal arteries, and supplying the occipitalis, the integument, and pericranium. One of the terminal branches may give off a meningeal twig, which passes through the parietal foramen. End of Section 12. Recording by Selena Arter. Of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Anatomy of the Human Body, Part 3, by Henry Gray. The External Carotid Artery, Part 2. 5. The posterior auricular artery, A. auricularis posterior, is small and arises from the external carotid, above the digastricus and stylohyoideus, opposite the apex of the styloid process. It ascends under cover of the parotid gland on the styloid process of the temporal bone to the groove between the cartilage of the ear and the mastoid process, immediately above which it divides into its auricular and occipital branches. Branches. Besides several small branches to the digastricus, stylohyoideus, and sternocleidomastoideus, and to the parotid gland, this vessel gives off 3 branches: stylomastoid, auricular, occipital. The stylomastoid artery, A. stylomastoidea, enters the styloid mastoid foramen and supplies the tympanic cavity, the tympanic antrum and mastoid cells, and the semicircular canals. In the young subject, a branch from this vessel forms, with the anterior tympanic artery from the internal maxillary, a vascular circle which surrounds the tympanic membrane, and from which delicate vessels ramify on that membrane. It anastomoses with the superficial petrosal branch of the middle meningeal artery by a twig which enters the hiatus canalis fascialis. The auricular branch, ramus auricularis, ascends behind the ear, beneath the auricularis posterior, and is distributed to the back of the auricula, upon which it ramifies minutely, some branches curving around the margin of the cartilage, others perforating it, to supply the anterior surface. It anastomoses with the parietal and anterior auricular branches of the superficial temporal. The occipital branch, ramus occipitalis, passes backward over the sternocleidomastoideus to the scalp above and behind the ear. It supplies the occipitalis and the scalp in this situation and anastomoses with the occipital artery. 6. The ascending pharyngeal artery, A. pharyngea ascendens, the smallest branch of the external carotid, is a long, slender vessel, deeply seated in the neck, beneath the other branches of the external carotid and under the stylopharyngeus. It arises from the back part of the external carotid, near the commencement of that vessel, and ascends vertically between the internal carotid and the side of the pharynx, to the undersurface of the base of the skull, lying on the longus capitis. Branches. Its branches are pharyngeal, palatine, prevertebral, inferior tympanic, posterior meningeal. The pharyngeal branches, rami pharyngeae, are 3 or 4 in number. 2 of these descend to supply the constrictores pharyngeus medius and inferior, and the stylopharyngeus, ramifying in their substance and in the mucous membrane lining them. The palatine branch varies in size, and may take the place of the ascending palatine branch of the facial artery, when that vessel is small. It passes inward upon the constrictor pharyngeus superior, sends ramifications to the soft palate and tonsil, and supplies a branch to the auditory tube. The prevertebral branches are numerous small vessels, which supply the longi capitis and coli, the sympathetic trunk, the hypoglossal and vagus nerves, and the lymph glands. They anastomose with the ascending cervical artery. The inferior tympanic artery, A. tympanica inferior, is a small branch which passes through a minute foramen in the petrous portion of the temporal bone, in company with the tympanic branch of the glossopharyngeal nerve, to supply the medial wall of the tympanic cavity and anastomose with the other tympanic arteries. The meningeal branches are several small vessels, which supply the dura mater. 1. The posterior meningeal enters the cranium through the jugular foramen. A second passes through the foramen lacerum, and occasionally a third through the canal for the hypoglossal nerve. The superficial temporal artery, A. temporalis superficialis, the smaller of the 2 terminal branches of the external carotid, appears, from its direction, to be the continuation of that vessel. It begins in the substance of the parotid gland, behind the neck of the mandible, and crosses over the posterior root of the zygomatic process of the temporal bone. About 5 centimeters above this process, it divides into 2 branches, a frontal and a parietal. Relations. As it crosses the zygomatic process, it is covered by the auricularis anterior muscle and by a dense fascia. It is crossed by the temporal and zygomatic branches of the facial nerve and 1 or 2 veins, and is accompanied by the auriculotemporal nerve, which lies immediately behind it. Branches. Besides some twigs to the parotid gland, to the temporomandibular joint, and to the masseter muscle, its branches are transverse facial, middle temporal, anterior auricular, frontal, parietal. The transverse facial artery, A. transversa fascia, is given off from the superficial temporal before that vessel quits the parotid gland, Running forward through the substance of the gland, it passes transversely across the side of the face, between the parotid duct and the lower border of the zygomatic arch, and divides into numerous branches, which supply the parotid gland and duct, the masseter and the integument, and anastomose with the external maxillary, masseteric, buccinator, and infraorbital arteries. This vessel rests on the masseter, and is accompanied by one or two branches of the facial nerve. The middle temporal artery, A. temporalis media, arises immediately above the zygomatic arch, and, perforating the temporal fascia, gives branches to the temporalis, anastomosing with the deep temporal branches of the internal maxillary. It occasionally gives off a zygomatico-orbital branch, which runs along the upper border of the zygomatic arch, between the two layers of the temporal fascia, to the lateral angle of the orbit. This branch, which may arise directly from the superficial temporal artery, supplies the orbicularis oculi, and anastomoses with the lacrimal and palpebral branches of the ophthalmic artery. The anterior auricular branches, rami auricularis anteriores, are distributed to the anterior portion of the auricula, the lobule, and part of the external meatus, anastomosing with the posterior auricular. The frontal branch, ramus frontalis anterior temporal, runs tortuously upward and forward to the forehead, supplying the muscles, integument, and pericranium in this region, and anastomosing with the supraorbital and frontal arteries. The parietal branch, ramus parietalis posterior temporal, larger than the frontal, curves upward and backward on the side of the head, lying superficial to the temporal fascia, and anastomosing with its fellow of the opposite side, and with the posterior auricular and occipital arteries. 8. The internal maxillary artery, A. maxillaris interna, the larger of the two terminal branches of the external carotid, arises behind the neck of the mandible, and is at first embedded in the substance of the parotid gland. It passes forward between the ramus of the mandible and the spheno-mandibular ligament, and then runs, either superficial or deep, to the pterygoideus externus, to the pterygopalatine fossa. It supplies the deep structures of the face, and may be divided into mandibular, pterygoid, and pterygopalatine portions. The first, or mandibular portion, passes horizontally forward, between the ramus of the mandible and the spheno-mandibular ligament, where it lies parallel to and a little below the auriculotemporal nerve. It crosses the inferior alveolar nerve and runs along the lower border of the pterygoideus externus. The second, or pterygoid portion, runs obliquely forward and upward under cover of the ramus of the mandible and insertion of the temporalis on the superficial, very frequently on the deep, surface of the pterygoideus externus. It then passes between the two heads of origin of this muscle and enters the fossa. The third, or pterygopalatine portion, lies in the pterygopalatine fossa in relation with the sphenopalatine ganglion. The branches of this vessel may be divided into three groups, corresponding with its three divisions. Branches of the first, or mandibular portions: anterior tympanic, deep auricular, middle meningeal, accessory meningeal, inferior alveolar. The anterior tympanic artery, A. tympanica anterior, tympanic artery, passes upward behind the temporomandibular articulation, enters the tympanic cavity through the petrotympanic fissure, and ramifies upon the tympanic membrane, forming a vascular circle around the membrane with the stylomastoid branch of the posterior auricular, and anastomosing with the artery of the pterygoid canal and with the caroticotympanic branch from the internal carotid. The deep auricular artery, A. auricularis profunda, often arises in common with the preceding. It ascends in the substance of the parotid gland, behind the temporomandibular articulation, pierces the cartilaginous or bony wall of the external acoustic meatus, and supplies its cuticular lining and the outer surface of the tympanic membrane. It gives a branch to the temporomandibular joint. The middle meningeal artery, A. meningia media, medidural artery, is the largest of the arteries which supply the dura mater. It ascends between the sphenomandibular ligament and the pterygoideus externus, and between the two roots of the auriculotemporal nerve to the foramen spinosum of the sphenoid bone, through which it enters the cranium. It then runs forward in a groove on the great wing of the sphenoid bone, and divides into two branches, anterior and posterior. The anterior branch, the larger, crosses the great wing of the sphenoid, reaches the groove or canal in the sphenoidal angle of the parietal bone, and then divides into branches which spread out between the dura mater and internal surface of the cranium, some passing upward as far as the vertex, and others backward to the occipital region. The posterior branch curves backward on the squama of the temporal bone, and, reaching the parietal some distance in front of its mastoid angle, divides into branches which supply the posterior part of the dura mater and cranium. The branches of the middle meningeal artery are distributed partly to the dura mater, but chiefly to the bones. They anastomose with the arteries of the opposite side, and with the anterior and posterior meningeal. The middle meningeal on entering the cranium gives off the following branches. 1. Numerous small vessels supply the semilunar ganglion and the dura mater in this situation. 2. A superficial petrosal branch enters the hiatus of the facial canal, supplies the facial nerve, and anastomoses with the stylomastoid branch of the posterior auricular artery. 3. A superior tympanic artery runs in the canal for the tensor tympani and supplies this muscle and the lining membrane of the canal. 4. Orbital branches pass through the superior orbital fissure or through separate canals in the great wing of the sphenoid to anastomose with the lacrimal or other branches of the ophthalmic artery. 5. Temporal branches pass through foramina in the great wing of the sphenoid and anastomose in the temporal fossa with the deep temporal arteries. The accessory meningeal branch, ramus meningeus accessorius, small meningeal, or parvidoral branch, is sometimes derived from the preceding. It enters the skull through the foramen ovale and supplies the semilunar ganglion and dura mater. The inferior alveolar artery, A. alveolaris inferior, inferior dental artery, descends with the inferior alveolar nerve to the mandibular foramen on the medial surface of the ramus of the mandible. It runs along the mandibular canal in the substance of the bone, accompanied by the nerve, and opposite the first premolar tooth divides into two branches, incisor and mental. The incisor branch is continued forward beneath the incisor teeth as far as the middle line, where it anastomoses with the artery of the opposite side. The mental branch escapes with the nerve at the mental foramen, supplies the chin, and anastomoses with the submental and inferior labial arteries. Near its origin, the inferior alveolar artery gives off a lingual branch, which descends with the lingual nerve and supplies the mucous membrane of the mouth. As the inferior alveolar artery enters the foramen, it gives off a mylohyoid branch, which runs in the mylohyoid groove, and ramifies on the undersurface of the mylohyoideus. The inferior alveolar artery and its incisor branch during their course through the substance of the bone give off a few twigs, which are lost in the cancellous tissue, and a series of branches which correspond in number to the roots of the teeth. These enter the minute apertures at the extremities of the roots and supply the pulp of the teeth. Branches of the second or pterygoid portion: deep temporal, pterygoid, mesenteric, Buccinator. The deep temporal branches, 2 in number, anterior and posterior, ascend between the temporalis and the pericranium. They supply the muscle and anastomose with the middle temporal artery. The anterior communicates with the lacrimal artery by means of small branches which perforate the zygomatic bone and great wing of the sphenoid. The pterygoid branches, rami pterygoidae, irregular in their number and origin, supply the pterygoidae. The masseteric artery, A. masseterica, is small and passes lateralward through the mandibular notch to the deep surface of the masseter. It supplies the muscle and anastomoses with the masseteric branches of the external maxillary and with the transverse facial artery. The buccinator artery, A. buccinatoria, buccal artery, is small and runs obliquely forward between the pterygoideus internus and the insertion of the temporalis to the outer surface of the buccinator, to which it is distributed, anastomosing with branches of the external maxillary and with the infraorbital. Branches of the third or pterygopalatine portion. Posterior superior alveolar. Infraorbital. Descending palatine. Artery of the pterygoid canal. Pharyngeal. Sphenopalatine. The posterior superior alveolar artery, A. alveolaris superior posterior alveolar or posterior dental artery, is given off from the internal maxillary, frequently in conjunction with the infraorbital just as the trunk of the vessel is passing into the pterygopalatine fossa. Descending upon the tuberosity of the maxilla, it divides into numerous branches, some of which enter the alveolar canals to supply the molar and premolar teeth and the lining of the maxillary sinus, while others are continued forward on the alveolar process to supply the gums. The infraorbital artery, A. infraorbitalis, appears from its direction to be the continuation of the trunk of the internal maxillary, but often arises in conjunction with the posterior superior alveolar. It runs along the infraorbital groove and canal with the infraorbital nerve, and emerges on the face through the infraorbital foramen, beneath the infraorbital head of the quadratus labii superioris. While in the canal, it gives off A. orbital branches which assist in supplying the rectus inferior and obliquus inferior and the lacrimal sac, and B. anterior superior alveolar branches which descend through the anterior alveolar canals to supply the upper incisor and canine teeth and the mucous membrane of the maxillary sinus. On the face, some branches pass upward to the medial angle of the orbit and the lacrimal sac, anastomosing with the angular branch of the external maxillary artery. Others run toward the nose, anastomosing with the dorsal nasal branch of the ophthalmic, and others descend between the quadratus labii superioris and the caninus, and anastomose with the external maxillary, transverse facial, and buccinator arteries. The 4 remaining branches arise from that portion of the internal maxillary which is contained in the pterygopalatine fossa. The descending palatine artery, A. palatina descendens, descends through the pterygopalatine canal with the anterior palatine branch of the sphenopalatine ganglion, and, emerging from the greater palatine foramen, runs forward in a groove on the medial side of the alveolar border of the hard palate to the incisive canal. The terminal branch of the artery passes upward through this canal to anastomose with the sphenopalatine artery. Branches are distributed to the gums, the palatine glands, and the mucous membrane of the roof of the mouth, while in the pterygopalatine canal it gives off twigs which descend in the lesser palatine canals to supply the soft palate and palatine tonsil, anastomosing with the ascending palatine artery. The artery of the pterygoid canal, A. canalis pterygoidea. Vidian artery. passes backward along the pterygoid canal with the corresponding nerve. It is distributed to the upper part of the pharynx and to the auditory tube, sending into the tympanic cavity a small branch which anastomoses with the other tympanic arteries. The pharyngeal branch is very small. It runs backward through the pharyngeal canal with the pharyngeal nerve and is distributed to the upper part of the pharynx and to the auditory tube. The sphenopalatine artery, A. sphenopalatina nasopalatine artery, passes through the sphenopalatine foramen into the cavity of the nose at the back part of the superior meatus. Here it gives off its posterior lateral nasal branches which spread forward over the conchae and meatuses, anastomose with the ethmoidal arteries and the nasal branches of the descending palatine, and assist in supplying the frontal, maxillary, ethmoidal, and sphenoidal sinuses. Crossing the undersurface of the sphenoid, the sphenopalatine artery ends on the nasal septum as the posterior septal branches. These anastomose with the ethmoidal arteries and the septal branch of the superior labial. One branch descends in a groove on the vomer to the incisive canal and anastomoses with the descending palatine artery. End of section 13. Recording by Selena Arter.
Section 14 of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Read by Carolyn Power. The side of the neck presents a somewhat quadrilateral outline, limited above by the lower border of the body of the mandible and an imaginary line extending from the angle of the mandible to the mastoid process, below by the upper border of the clavicle, in front by the middle line of the neck, behind by the anterior margin of the trapezius. This space is subdivided into two large triangles by the sternocleidomastoideus, which passes obliquely across the neck from the sternum and clavicle below to the mastoid process and occipital bone above. The triangular space in front of this muscle is called the anterior triangle, and that behind it the posterior triangle. Anterior triangle. The anterior triangle is bounded in front by the middle line of the neck, behind by the anterior margin of the sternocleidomastoideus. Its base, directed upward, is formed by the lower border of the body of the mandible, and a line extending from the angle of the mandible to the mastoid process. Its apex is below, at the sternum. This space is subdivided into four smaller triangles by the digastricus above and the superior belly of the omohyoideus below. These smaller triangles are named the inferior carotid, the superior carotid, the submaxillary, and the suprahyoid. The inferior carotid or muscular triangle is bounded in front by the median line of the neck from the hyoid bone to the sternum, behind by the anterior margin of the sternocleidomastoideus, above by the superior belly of the omohyoideus. It is covered by the integument superficial fascia, platysma, and deep fascia, ramifying in which are some of the branches of the supraclavicular nerves. Beneath these superficial structures are the sternohyoideus and the sternothyroideus, which, together with the anterior margin of the sternocleidomastoideus, conceal the lower part of the common carotid artery. Footnote: Therefore, the common carotid artery and the internal jugular vein are not, strictly speaking, contained in this triangle, since they are covered by the sternocleidomastoideus, that is to say, they lie under that muscle which forms the posterior border of the triangle. But as they lie very close to the structures which are really contained in the triangle, and whose position it is essential to remember in operating on this part of the artery, it is expedient to study the relations of all these parts together. End footnote. This vessel is enclosed within its sheath, together with the internal jugular vein and vagus nerve. The vein lies lateral to the artery on the right side of the neck, but overlaps it below on the left side. The nerve lies between the artery and vein, on a plane posterior to both. In front of the sheath are a few descending filaments from the ansa hypoglossae. Behind the sheath are the inferior thyroid artery, the recurrent nerve, and the sympathetic trunk, and on its medial side, the esophagus, the trachea, the thyroid gland, and the lower part of the larynx. By cutting into the upper part of this space and slightly displacing the sternocleidomastoideus, the common carotid artery may be tied below the omohyoideus. The superior carotid or carotid triangle is bounded behind by the sternocleidomastoideus, below by the superior belly of the omohyoideus, and above by the stylohyoideus and the posterior belly of the digastricus. It is covered by the integument, superficial fascia, platysma, and deep fascia, ramifying in which are branches of the facial and cutaneous cervical nerves. Its floor is formed by parts of the thyrohyoideus, hyoglossus, and the constrictors pharyngis medius and inferior. This space, when dissected, is seen to contain the upper part of the common carotid artery, which bifurcates opposite the upper border of the thyroid cartilage into the external and internal carotid. These vessels are somewhat concealed from view by the anterior margin of the sternocleidomastoideus, which overlaps them. The external and internal carotids lie side by side, the external being the more anterior of the two. The following branches of the external carotid are also met with in this space: the superior thyroid running forward and downward, the lingual directly forward, the external maxillary forward and upward, the occipital backward, and the ascending pharyngeal directly upward on the medial side of the internal carotid. The veins met with are the internal jugular, which lies on the lateral side of the common and internal carotid arteries, and veins corresponding to the above-mentioned branches of the external carotid, viz., the superior thyroid, the lingual, common facial, ascending pharyngeal, and sometimes the occipital, all of which end in the internal jugular. The nerves in this space are the following. In front of the sheath of the common carotid is the ramus descendens hypoglossae. The hypoglossal nerve crosses both the internal and external carotids above, curving around the origin of the occipital artery. Within the sheath, between the artery and vein, and behind both, is the vagus nerve. Behind the sheath, the sympathetic trunk. On the lateral side of the vessels, the accessory nerve runs for a short distance before it pierces the sternocleidomastoideus, and on the medial side of the external carotid, just below the hyoid bone, may be seen the internal branch of the superior laryngeal nerve, and still more inferiorly, the external branch of the same nerve. The upper portion of the larynx and lower portion of the pharynx are also found in the front part of this space. The submaxillary or digastric triangle corresponds to the region of the neck immediately beneath the body of the mandible. It is bounded above by the lower border of the body of the mandible and a line drawn from its angle to the mastoid process, below by the posterior belly of the digastricus and the stylohyoideus, in front by the anterior belly of the digastricus. It is covered by the integument, superficial fascia, platysma, and deep fascia, ramifying in which are branches of the facial nerve and ascending filaments of the cutaneous cervical nerve. Its floor is formed by the mylohyoideus, hyoglossus, and constrictor pharyngis superior. It is divided into an anterior and a posterior part by the stylomandibular ligament. The anterior part contains the submaxillary gland, superficial to which is the anterior facial vein, while embedded in the gland is the external maxillary artery and its glandular branches. Beneath the gland, on the surface of the mylohyoideus, are the submental artery and the mylohyoid artery and nerve. The posterior part of this triangle contains the external carotid artery ascending deeply in the substance of the parotid gland. This vessel lies here in front of and superficial to the internal carotid, being crossed by the facial nerve, and gives off in its course the posterior auricular, superficial temporal, and internal maxillary branches. More deeply are the internal carotid, the internal jugular vein, and the vagus nerve, separated from the external carotid by the styloglossus and the stylopharyngeus, and the glossopharyngeal nerve. Footnote: the remark made about the inferior carotid triangle applies also to this one. The structures enumerated as contained in its posterior part lie, strictly speaking, beneath the muscles which form the posterior boundary of the triangle, but as it is very important to bear in mind their close relation to the parotid gland, all these parts are spoken of together. End footnote. The suprahyoid triangle is limited behind by the anterior belly of the digastricus, in front by the middle line of the neck between the mandible and the hyoid bone, below by the body of the hyoid bone. Its floor is formed by the mylohyoideus. It contains 1 or 2 lymph glands and some small veins. The latter unite to form the anterior jugular vein. Posterior triangle. The posterior triangle is bounded in front by the sternocleidomastoideus, behind by the anterior margin of the trapezius. Its base is formed by the middle third of the clavicle, its apex by the occipital bone. The space is crossed about 2.5 centimeters above the clavicle by the inferior belly of the omohyoideus, which divides it into 2 triangles, an upper or occipital and a lower or subclavian. The occipital triangle, the larger division of the posterior triangle, is bounded in front by the sternocleidomastoideus, behind by the trapezius, below by the omohyoideus. Its floor is formed from the above downward by the splenius capitis, levator scapulae, and the scaleni medius and posterior. It is covered by the skin, the superficial and deep fasciae, and by the platysma below. The accessory nerve is directed obliquely across the space from the sternocleidomastoideus, which it pierces, to the under surface of the trapezius. Below, the supraclavicular nerves and the transverse cervical vessels and the upper part of the brachial plexus cross this space. A chain of lymph glands is also found running along the posterior border of the sternocleidomastoideus, from the mastoid process to the root of the neck. The subclavian triangle, the smaller division of the posterior triangle, is bounded above by the inferior belly of the omohyoideus, below by the clavicle. Its base is formed by the posterior border of the sternocleidomastoideus. Its floor is formed by the first rib with the first digitation of the serratus anterior. The size of the subclavian triangle varies with the extent of attachment of the clavicular portions of the sternocleidomastoideus and trapezius, and also with the height at which the omohyoideus crosses the neck. Its height also varies according to the position of the arm, being diminished by raising the limb on account of the ascent of the clavicle, and increased by drawing the arm downward when that bone is depressed. This space is covered by the integument, the superficial and deep fasciae, and the platysma, and crossed by the supraclavicular nerves. Just above the level of the clavicle, the third portion of the subclavian artery curves lateralward and downward from the lateral margin of the scalenus anterior across the first rib to the axilla, and this is the situation most commonly chosen for ligaturing the vessel. Sometimes this vessel rises as high as 4 centimeters above the clavicle. Occasionally, it passes in front of the scalenus anterior or pierces the fibers of that muscle. The subclavian vein lies behind the clavicle and is not usually seen in this space, but in some cases it rises as high as the artery, and has even been seen to pass with that vessel behind the scalenus anterior. The brachial plexus of nerves lies above the artery and in close contact with it. Passing transversely behind the clavicle are the transverse scapular vessels, and traversing its upper angle in the same direction, the transverse cervical artery and vein. The external jugular vein runs vertically downward behind the posterior border of the sternocleidomastoideus to terminate in the subclavian vein. It receives the transverse cervical and transverse scapular veins, which form a plexus in front of the artery, and occasionally a small vein which crosses the clavicle from the cephalic. The small nerve to the subclavius also crosses this triangle about its middle, and some lymph glands are usually found in the space. End of section 14. Read by Carolyn Power.